Hi, my name is Megan Goheiser, and thank you for tuning in to my verbal presentation for my portfolio project reflection. There were a couple of questions asked for this reflection, and this speech is going to cover them. The first question asks to reflect on what you have learned as a result of completing this project and what you would do differently for continual improvement on this or future portfolio projects. My 3-page portfolio project allowed me to understand not only nurse burnout, but also how to research and put the information that I gathered into a memo format. Meeting the guidelines for successful writing included identifying my audience, putting together a clear and concise introduction, provide the reader with practical information, and give recommendations in the conclusion to reach my intended audience. While this portfolio project had a limited scope of research, I feel what I would do differently would be to research more in-depth, more reliable sources and include professional interviews of real nurses that have experienced nurse burnout on a more personal level. This type of portfolio project allowed me to choose a workplace topic that relates to my future career. The second question asks to identify and explain how the course and institutional outcomes were met on this project. The institutional outcome of information literacy and communication was used during my portfolio project by using Microsoft Word and the online library to gain access to the resources to put together a professional paper. The relational learning outcome was used when I took information and situations from my current position as a nurse tech and applied it to my paper. For the institutional outcome thinking abilities, I employed strategies for reflection by thinking collectively as a team on my nursing floor to provide nurse burnout examples for my paper. I used quantitative and scientific reasoning when researching statistics on nurse burnout. Using numbers in a paper establishes a more factual read to the intended audience. In using community and career institutional outcome, it is important to remember that in training to become a nurse, professional career development is vital. According to the class syllabus, the 2 main course outcomes that I feel were most important to this specific project were to analyze situations, audiences, and desired goals to determine the written format appropriate to the purpose of the message, and the second one was to prepare a clear and concise computer-generated letters, memos, reports, and proposals. The third question asks to describe how what you have learned throughout this course aligns with the dependability workplace capability. 2 adjectives that describe dependability would be trustworthy and reliable. I learned throughout this course that coming up with dependable and reliable sources to do the annotated bibliography helped put together an effective job-related portfolio project. Using the online Bryant and Stratton College Library was most effective in supporting my project. The fourth question asks to choose one additional workplace capability from the table and discuss it. The second workplace capability that I chose is communication. I chose this capability because communication is key when writing a professional paper. 2 main types of communication are verbal and nonverbal. In writing the professional portfolio project, using written nonverbal communication allows the intended audience to understand clearly because the paper was clear, concise, and organized. Now, the 5th and final question was to analyze importance of these workplace capabilities for your future career. I chose perseverance, problem solving, and tolerance, and these are 3 excellent workplace capability examples for nurses. This is because, as a nurse, you can't give up on difficult patients, you need to be able to think intuitively and quickly, and having tolerance as a nurse relates to cultural sensitivity. Thank you for listening to my portfolio project reflection.